Well, welcome to the 118th annual community meeting of the Littleton Regional Healthcare Organization. We're really happy that you could all join us tonight. My name is Ashley Garrison, and as of this January, I am the chair of the LRH board. I've been on the board since 2018, and I am exceptionally grateful that I get to be involved with such an amazing organization. We may be a very rural community hospital, but we are very mighty in our vision and accomplishments. And first, I wanted to read some remarks from Bob Nutter, our president and CEO. Bob's unable to join us today as he is recovering from surgery. He sends his regrets for missing what is one of his favorite events of the year. Bob did want me to share a few updates on his behalf. I regret not being with all of you today. Although no one looks forward to surgery, I am grateful to have my long-standing back issue addressed by our highly skilled clinical team. I trust my care to our team here at LRH. As is our tradition, several members of the LRH leadership and trustees will provide updates from the past fiscal year. I want to highlight a few as well. Each year, we review accomplishments with a lens on our mission to provide quality, compassionate, and accessible health care in a manner that brings value to all. 2024 was no exception. We welcome many new additions to our medical staff, and we also appointed several individuals to key leadership roles. As the region's leader in healthcare services, LRH assumed full ownership of Lincoln Urgent Care. We expanded our services in rehabilitation and radiology, and we were accredited for our sleep program. Healthcare continues to change and shift. In fact, New Hampshire experienced more consolidation in 2024. We continue to explore affiliation that would enhance our mission and our services, and our approach is to do it right, not do it right now. We are a strong organization and are addressing this from a position of strength and partnership. As you all know, we have been significantly challenged by the Cerner integration from operations to billing. Getting this right is and will remain a very high priority for 2025. Last, I want to give some special thanks. I want to thank Dr. Jennifer Lucas. Along with her duties as LRH's staff urologist, she took on the role of medical staff president for the past 2 years. As the liaison between medical staff and administration, Dr. Lucas managed issues relating to medical practice and policy in collaboration with hospital leadership. In her role as president, she led the medical staff in the delivery of high-quality, safe, and patient-centered care. I also want to thank Fred Chisholm. He served our board for 7 years, with the last year as our board treasurer. He is stepping away to fulfill a higher calling, that of an Episcopal priest. I am grateful for his unique and compassionate perspective in service and board leadership. Finally, I want to thank Jeff Woodward, who served on the board for 11 years. His leadership, advice, and counsel has been invaluable. He has played a key role in leading the affiliation discussions, and I'm very pleased to say that he has agreed to continue to have a lead role in this work. Thank you and enjoy your evening. Okay. And so thank you to everyone who makes this hospital such a great place to work and to receive care. I would like to ask the following groups to stand briefly when I call your name. The Board of Trustees, if we have any here. Thank you. Our executive and leadership team. Our auxiliary and volunteers. Our staff. And finally, Jurgen and the food and nutrition team, who are currently setting up a really amazing feast next door. And then briefly, this is the order of events for tonight with our featured speakers. We have a great and informative program ahead of us, and our team will fill you in on all the interesting things that have happened at Littleton Regional Healthcare over this past fiscal year. First up is Jeff Woodward, who served as the LRH board chair over this past fiscal year, with 2024 marking his last year as chair. We are all very appreciative of his leadership, steady hand, and willingness to serve LRH whenever needed.
Thank you. So it's obvious we didn't work this out together with Bob going through what he's going through, because he stole half what I was going to say already. So this should be fine. So Don, you good to go? Yeah. So here's a list of our Board of Trustees for the 2024 season. And as Ashley already had you stand up, I was going to do the same thing. But just want to thank you for your support over the year and your willingness to serve here at the hospital. It's really been a great group of people and really important to have a diverse group, which we do have, so it's been great. And again, okay, Don, as Bob already mentioned, this is our mission statement, so he stole that one too, but that's okay. So this is our mission statement, but also I think there's one other statement that you could kind of figure around LRH, and that's that this is a very good hospital with great food. And we know that's why you're here tonight. So we're going to get through this agenda as quickly as possible so we can move on to the good stuff. Over the past 3 years, the board, along with management, has dealt with some significant issues. Bob mentioned one of them with the Cerner conversion. Thanks to an engaged and diverse board, the management and LRH and the board have got through this in pretty good shape, and I think we've come through it as well as we could. And it hasn't been without its challenges, but I think with the accounting department, they've got their hands around the Cerner issue to get that going in the right direction, so we feel pretty good about it. The following charts show the growth that LRH has continued to see over the last years. Laboratory is up 44% over the past 4 years. Radiology is up 29% over the last 4 years. Operating room cases are up by 33%. You can see clinic, the next screen, has a little blip in the screen, came down. That's where we lost primary care doc. But you can see it's trending in the right direction now, and I'm sure Corinne will talk about the success we've had in recruiting new employees here at the hospital. And the last one is, emergency department is doing very well and continues to be very busy, and that's up 33% in the last 4 years. And as a secret admirer, I can tell you they do a great job. Lastly, the emergency department, the urgent care, which you already talked about. I was going to talk about that as well, the Lincoln urgent care, but that's going very well. So we have an urgent care in Lincoln and urgent care here at LRH. LRH has a great staff, very strong management team, which makes us feel good about handling any issues that may come up in the future. I've worked closely with the management team here for several years, and it's been a pleasure. I want to recognize Dawn, who is the liaison to the board, along with all her other duties. She makes a board member here feel very comfortable. She has it prepared for the board meetings, and as a chair of the board, her being with us is invaluable. She's unbelievable. So she makes our jobs pretty easy here, being a volunteer. Lastly, we went on a site visit a couple years ago to another hospital, and during that site visit, they said, "Oh, we know LRH," and their quote was, "LRH is a critical access hospital on steroids." And I think that really sums up what LRH is. With all we offer here, it's unusual to have as many services we offer here at LRH and a critical access hospital. And I thought that comment was really meaningful and meant a lot to all of us who were there to think that they respect this hospital, the staff, and everyone that much. Thank you.
Good evening, everyone. I appreciate the opportunity to speak tonight. I appreciate the invitation from the board. I'll get this redirected here. Tonight, we obviously celebrate 118 years of Littleton Regional Healthcare and its service to our community. Littleton Hospital first opened its doors in 1907 on the other side of town. This facility was opened in 2001. And over all those years, the goal has always been to provide the highest quality of care. As medical staff president incoming, I am honored to represent an outstanding group of physicians and advanced practice professionals who work toward that goal of quality care. I want to emphasize to all in our community, really sorry about that. I want to emphasize to all in our community the importance of the Board of Trustees and how it works with the hospital and medical staff to ensure the delivery of quality care. To that end, I would like to provide a brief overview of the medical staff and its relationship to the Board of Trustees. First and foremost, the Board of Trustees has final authority for the delivery of health care. The Board of Trustees is the governing body responsible for the quality of care delivered here at LRH and for the proper credentialing of staff members who provide that care. The medical staff works under the authority of the board as a professional entity established and organized by the board to provide professional and technical expertise to advise the board in the pursuit of quality care. Next slide. The medical staff is organized and governed with elected officers, a medical executive committee, medical and surgical services committees and subcommittees, all that are ultimately responsible to the board. Quality is driven and protected by the medical staff in several roles: credentialing, privileging and peer review of its providers. All recommendations in these areas are ultimately sent to the board for final approval. So, simply put, the relationship between the board and the medical staff provides the structure that allows the delivery of quality care. Over the past year, our capacity for the delivery of care has expanded greatly. We've added many new providers. This is a list of the full 44 additions. The majority of the additions here are telehealth providers. Obviously not on site, but they provide invaluable subspecialty expertise and after-hours coverage. 14 of these providers are on site, and I would now like to individually introduce them by specialty. First, in primary care, we have 6 new providers: Dr. John Monmany, and then APRNs Jamie Wagner, Gordon Black, Erica Deckel, Paige Tomlinson, and Jacqueline Siegel. With these additions, our primary care capacity has expanded greatly, fulfilling a major need in our primary care department. We have 3 new providers in orthopedics, adding expertise to our well-established, high-quality orthopedic service. These new providers are Dr. Scott Marr, Dr. Glenn Lieberman, and Jessica Lorenz Armstrong, APRN. In medicine, we have a new addition. Dr. Carla Nordstrom adds subspecialty pulmonology expertise and is a welcome addition to our medical team. Finally, in emergency medicine and urgent care, we have 4 new providers. Dr. Lon Setnick, who's on duty today in our ED, joins a great team that we have here now. Jameson Boswell, PA, works urgent cares both here in Littleton and in Lincoln. Katie Leone, APRN, and David Dickinson, PA, are both working in our urgent care in Lincoln. So I'd like to welcome these 14 new providers to our on-site facilities. By necessity, recruitment is an ongoing effort. And thanks to Lou Irvin, we have lots of success in that area over the past year. I'd like to announce tonight, and I'm excited by it, that we have several excellent new providers in the pipeline for the coming year already, at least 5. So that's very good. In conclusion, I would simply like to thank all the members of the Board of Trustees and all of my colleagues in the medical staff for all their hard work and service to our community. Thank you.
Very good. Good evening. My name is Fred Chisholm, and I am the outgoing treasurer. It's a pleasure to be here. It's a pleasure to be part of this organization. I think one of the most important things for me about LRH is that we as a hospital understand the subtle difference between being made well and being cared for. Okay, and you can be made well in a lot of places. But the question is, how is that care delivered to you? Is it delivered to you and your family in a way that makes you feel cared for? Because that's really what makes the difference in the way that people experience health care. So I have been proud over the last 7 years to be part of this organization, and I will miss it because it cares for people. It doesn't just make them well. Speaking to the financials over the past year, the gross revenue in '24 was $22 million above budget, or 9% better than we had planned, and $28 million above the prior year. So good growth there. Our net revenue was less than budget for reasons that have already been alluded to by Jeff Woodward, challenges in our billing and collecting systems. Please know that this is a priority focus for us as we go forward this year and getting those things ironed out. It's all about turning activity into charges and turning charges into payments. And so that's really the workflow that we're chasing as we go forward. One of the key things is our growth in patient volume, which you have seen on Jeff's slides, the growth in revenue and assets. All of those are critical to our success as a hospital, and it speaks to the fact that we continue to experience market demand in our area. We don't just have a building and we don't just keep adding things to it. We add things to it because people come and because we're able to serve them when they do come. Dawn, if you could, thank you. What you see here now is that we have remained strong throughout the last 5 years. You can actually see the trend in growth. That little dip there is kind of post-COVID. I think the key takeaway here is that we're on a growth path that's going to continue to provide us the ability to serve all of the people who are part of our community. Currently, in fiscal 2025, in the first quarter, we are ahead of budget, and if that continues, we'll actually see a 21% growth by the end of 2025 versus where we were in 2023, which is pretty amazing. It means that we are continue to recover from the post-pandemic era, and there are smaller hospitals out there who have not been able to do that. I think that's a credit to the people who work here and the way that we care for people and the services that we provide, that when people have a choice, they choose to come here, even if they have to drive a long way. Next slide, please. With regard to the workforce, LRH has remained strong with our staffing. We have, I'm pleased to be part of an organization that values its employees. You see the staff awards on the website on a month-to-month basis, and there's always something there. The first time I looked at it, I was like, what is that? And then I'm like, oh, that's the B award, and just the little things that we do to focus on making this a good place to work, because the experience that the person who's providing your care has is the experience that you're going to have getting that care. And so we have to create an environment in which people understand that they matter, they understand that they're treated well, and they understand that they're compensated fairly and competitively for the work that they do. And that's part of what we do here. If you look at the contracted labor, what we call travelers there, you can see that we had a large number of travelers during COVID, and we did that because that is what was needed by our community, in order for us to provide the services that were required. We have, over the past couple of years, reduced that by about 40% since the last fiscal year, and part of what that means for us, part of the shift that represents, is that we're committed to hiring people from our own community whenever and wherever possible. That helps us in two ways. One, it provides jobs within our own community, but two, it also provides revenue circulation within our own community. It's not just about where people work, it's also about where people spend their money. It's about who they spend their time with, and that's one of the things that's been important to us. In addition to funding contract labor if required, the board has also made a commitment to improve the wages of our current and future employees. And so some of you may not know, we did a number of wage adjustments over the past several years to make sure that we were competitive, to make sure that this was a place that people wanted to come and could afford to come, so that we could get the best people that we could find to give you the care that we're committed to providing. Next slide, please. Last but not least, over 2024, we invested not just in, or I should say, we invested in capital in a variety of ways. We did that through infrastructure investments. We did that through facility investments. We did that also in technology investments. Why does that matter? That matters because we're trying to make sure that we're investing in the equipment to support patient care, and also we're investing in the technology that we need to provide the care that you expect from us. And so that's been part of our role as the board. Some of the investments we've made over the last year have been in areas such as obstetrics, surgery, radiology, and intensive care, to make sure that we can provide the kind of care that people expect from us and the kind of care that causes people to drive by other places to get here. Okay, so that's really what we're in pursuit of. At this point, I'd like to welcome Dr. Duffy up to provide his remarks. Thank you. It has been a great time.
Thanks. Thank you, Fred. On cue, my voice goes out. This is my 32nd annual meeting. I've seen a lot go on here. John's here somewhere. He's been to more. We've seen a lot go on here. But I think the thing that's striking, the takeaway from today is that we're growing. We have a lot of capabilities. We're having a little trouble getting the money in the door. But the place is bigger, and it does more than it's ever done before. This is really complicated to run hospitals. I'm the chief medical officer here. I'm also the executive vice president and have a bunch of other duties outside of the chief medical officer role. I don't really want to talk about those. Those aren't the fun ones. Delivering medical care is the fun one, and it's the thing that we do. This is our product here at LRH, delivering medical care. It's very complicated to run a hospital, but the fundamental is that you're delivering medical care. We don't deliver nursing care or x-ray care. We'd be a nursing home, or we'd be an x-ray center. We're a hospital. We deliver medical care. So fundamentally, the quality of the medical care is what really separates the wheat from the chaff on this. We have a commitment to continue the growth and the emphasis on delivering quality medical care. We want to do it here. We want to make it so that you don't have to go away to get good care, good medicine. We've been maintaining the higher standards, but we've actually developed now proven processes, and we have a new quality director that is bringing more excitement and more ideas into us as she comes from away to help us decide, well, it's nice sometimes to have some cross-pollination with the rest of the universe. But we're using proven methods and now advanced analytics to make sure that the care we're delivering, the medical care we're delivering, is excellent. We're growing, we've talked about that. It's got the same problem Jeff has. We're repeating a lot of stuff. And we really want to do a lot of this. This is our job. The job of the hospital is to be here to serve the community. And our product is medical care, so we want to expand and increase access for those services. Let's see the next one, Don. Let's see what we have here. We talked about it. LRH is very big for a critical access hospital, one of the largest in the United States. The number, 266 million. That's incredible for a critical access hospital. We know all this. I talk about medical care. That's our product. That's what we deliver. But the doctors and other providers can't do it by themselves. It's a team that has to get together and work together in unison and deliver their care at the forefront of the good medicine. So we're committed to that, and Corinna's going to talk about a lot of things. She's going to come up next. She's going to talk about a lot of things that supports the medical care that are vital and part of the thing that makes running hospitals difficult. Things have to be coordinated. Our theory is that to run a community hospital, and we look at ourselves as a community hospital, not a so-called critical access hospital, which is really an economic designation. Our theory is that you have to have some fundamental services that are excellent, above reproach, and we feel as though we've done that. And here in emergency medicine, I have fellowship-trained emergency physicians that are all board certified in their specialty. They all did residencies in emergency medicine. No more like me, a legacy guy who came from another specialty because the specialty was young when I was youngish. They're very good, very experienced. It's important to mention, from my perspective, that their average age is somewhere in their late 40s, which means they have experience, but they're not too grumpy, and they're nice to their patients. But emergency medicine here is a strength. Also a strength is our hospital service, led by Stephen Goldberg, who's one of our trustees. We have 2 base hospitalists that are here most of the time, along with a couple of other individuals who are also well-trained and share a similar philosophy to us. They are hospitalists first, trained in hospital medicine and do hospital medicine. They're excellent. They run the critical care unit. Along with their skills, they're able to real-time utilize the skills of the critical care specialists at Dartmouth Health. So we're trying to bring the very best for our community here to the North Country so you don't have to go away. Also, general surgery. You need to have good general surgeons. We have an excellent general surgeon. We're bringing in 2 others this year. It needs to be a team. Trauma care is important to us. We've been working with the state for the last 3 years to implement processes that will lead us to advanced trauma care designation. More to come on that in the coming months. We have everyone knows we have full service obstetric and gynecology. What does that mean, full service? They do gynecology too. They do gynecologic surgery and gynecologic care, and they also deliver babies. We have an excellent connection with Dartmouth Health. For the babies that need extra care, they can be quickly shuttled to DH. And we have actually in our delivery room a television hookup with them so that we can all examine the baby together and make decisions together. And we have world-class in-house radiology. Dr. Eric, who's our new medical staff president, is very experienced in high volume, upper and high level imaging with fellowship training in that. And we're able to do quite a bit here at LRH. So that's the fundamental service excellence that we feel as though that we have to deliver to you. But wait, there's more, as they say on TV. We maintain a lot of essential services that most critical access hospitals and some community hospitals don't offer. It's a big deal, but we've kept obstetrics. And thanks to our board, who tells us all the time, we're keeping obstetrics, we're keeping obstetrics. It's not going away. It's fundamental to the well-being of the region. We also have neuro and ortho spine surgery, unheard of, for all the people of the North Country with back pain and back issues. And it's quite obviously common. Everyone knows this. You'll be chuckling. You understand that so much. We can deal with that here, most cases here. We have, for instance, ENT and facial plastics and allergy. You don't have that everywhere. Oh, and the ear, nose, and throat physician does computer-assisted sinus surgery. You don't have to go away to get this. This is complicated surgery that can be done precisely here in this building. I was going to go on and tell you what the current state was. Eric talked quite a bit about that, so we'll really kind of just gloss over this, but we've grown. Under the leadership of the executive director of the medical group who works with me, Lou Irvin, we now have 10 providers, including 3 physicians in primary care. You saw the little dip in the volume earlier. That was, we lost people. People were aging out. People were moving on. We're adding another physician this spring, an internal medicine doctor. Neurosurgical spine, we added an additional surgeon to join Dr. Salerni. Pulmonology and sleep are back and better than ever. We've actually just accredited our sleep lab, as was mentioned earlier, and somebody mentioned it, Bob in his letter. Audiology. We've always had audiology. We have otolaryngology. We need to have it. We have 2 starting very soon. And we're adding the 2 additional surgeons as mentioned. What else you got? Okay, orthopedics also, growing. There's 12 physician surgeons and advanced practice providers in our ortho group. That's big. We do joint replacement surgery, lots, 300 plus a year. You don't have to go away. They come from far and wide, North Conway, the greater North Country, Coos County, and around us in Vermont. We've added additional capacity expertise. We now have an orthopedic surgeon who does spine, so it's called orthopedic spine. It's a different point of view, not different, works with the neurosurgeons. It's an excellent addition. Also coming into 2025, our joint replacement program will be bolstered by a new surgeon who's been recently trained. He's finishing up at Dartmouth right now in joint replacement surgery. It's his 2nd fellowship after residency. He's going to work with Dr. MacArthur, and the 2 are going to get together and infuse together their practice to serve more people as time goes on and to continue the excellence in that area. We're bringing in an upper extremity orthopedist. We already have a hand surgeon who does some upper extremity, Dr. Mullins. We're bringing in a young lady who's going to do other upper extremity, including total shoulders and elbows and wrists and things of that nature that sometimes we had to send away. Urgent care has grown. We talked about that. We've taken over. We've assumed management and ownership at the Lincoln facility. We owned half of it before and kind of jointly ran it with an outside for-profit group. It's all ours now. And we've seen a difference. The outside group was telling us, oh, no, it's not going to be a good proposition here. We're not seeing enough patients. We just broke all records this last week there. Attitude matters and commitment to quality matters. And Lou's done a lot of work on the occupational health program along with the providers down there and here. We brought on a number of large employers. We're gonna do occupational health finally the right way around here, in my opinion. See the next one. Chief Operating Officer and Chief Nursing Officer Corinne Sapucci.
Good evening. Thank you again for being here. So you've definitely heard a theme of quality, and you've heard that theme repeatedly because it's embedded in everything that we do here at LRH. It is the foundation of our approach to patient care. If we can't do it and do it well, we're not going to do it. We know our limitations, but our standards set us apart. We have been committed, even through the pandemic years, to maintain appropriate nurse-to-patient ratios, continually evaluate and implement evidence-based practice, and are committed to ongoing education and competency for all of our staff at every level. We employ board-certified physicians, specifically trained in their specialty, as Dr. Duffy referenced, but we also focus on the competency and education of all of our other clinicians, whether they are lab techs, our multimodality technicians in diagnostic imaging, our nursing staff. We focus on onboarding, stressing ongoing education, continuing education, and advanced certification, all supported by LRH. Our commitment to high quality is evident throughout our facility and in our incredible workforce. Without the arms and legs of our workforce, none of this is possible. We also have a high focus on collaborating with partners because we can't be everything to everyone. So through those clinical partnerships, as a critical access hospital, that allows us to offer a wider breadth of services. And as you've heard tonight, the big focus is access. We want patients to be able to get care in their own community and not make medical decisions based on geography and whether they have transportation to receive that care. These collaborations are long-standing and valuable to both entities to better serve our community. The three partnerships, which are just three among many that we have that I want to highlight tonight, are relationships with Dartmouth Health. You've heard referenced our telehealth services. We are able to have tertiary care level specialists support our providers here on the ground. What that means is our physicians and nursing staff have that expertise so that we can maintain you here in your own community. We have also worked closely with Mid-State Health Center to expand our visiting specialist program. So we are able to serve the greater central New Hampshire area through our partnership with Mid-State. Again, patients are able to see our specialist locally, and then if they need hospital care, they're able to come to us for that. And we've had a long-standing partnership with Ammonoosuc Community Health Services. They have a robust primary care program, and they rely on us for our specialists, and their patients have access to our lab, radiology, urgent care, pharmacy, and both we partner with Mid-State and Ammonoosuc to do our community health needs assessment. The community health needs assessment is what you, as our community members, tell us you need for care within the community. So by partnering with these other entities, we're then able to make an action plan on what our focus is going to be in the coming years to best meet your needs. Midstate also plays a key role in our Doorway program, which is LRH's substance use disorder clinic located in downtown Littleton, by providing our medical director. This program has been in place for a number of years and has been a huge success for supporting community members who have substance abuse issues. We'll partner, as I said, with Amanuense and Midstate to do our community health needs assessment, and we'll share the results of that with you at future meetings. We're also committed to your healthcare needs, as you've heard as a constant theme through tonight. We've talked about the Lincoln Urgent Care, and I think Fred said it best. We can provide care, but we provide care and experience top-notch. It's not just getting you well, as Fred mentioned. It's about truly caring for you, and that has been the difference that we've heard from patients in the greater Lincoln Woodstock area. Our patient satisfaction scores and feedback from that Lincoln Urgent Care have been tremendous. Some other areas that we have focused on is in expanding DME, which is durable medical equipment for patients who need assistive devices for their care. We did receive accreditation for our sleep program. This year, we did add our low-dose lung cancer CAT scan for patients who qualify for having this test done. And what that does is help detect patients at risk who may have something there. We are able to do that low-dose CT scan to find potential cancers much earlier. Obviously, earlier detection results in better long-term care for patients and their lives. We've also recently this year expanded our pediatric physical therapy program. We have a robust pediatric program, and we're discovering that a lot of our community members, if their children needed physical therapy, they were being referred out of the community. So we've expanded this into our current rehab program, both here at our Littleton site as well as our Franconia location. Everybody has heard about diabetes education. There's a big push this year, and Emily, our diabetes educator, has adopted the National Diabetic Prevention Program, which focuses on pre-diabetes care, earlier detection, getting patients connected to understand what their risk factors are and how to eliminate those, and identifying them earlier means better care for patients. Next slide. Our lab, we made a additional huge, with the support of the board, in our lab. We are the first and only critical access hospital in New England that has this automation system. It's kind of crazy that a small critical access hospital in northern New Hampshire is the first in New England, and I think one of 6 in the country to have this automation system. What does that mean for you? It means that we are able to do a larger volume of testing, which you saw our volume growth. We needed to be able to do more testing more efficiently. And what does that mean? That means when your physician orders lab tests for you, they get your results quicker so that they can make the next decision. You will get your results quicker if you've signed up in the portal. Your results are auto-verified and they go immediately there so that you can see your results. We had our eye on the future. Staffing in the lab is hard. There's not lab medical technician programs throughout the state, and this is also helping us to meet that staffing demand. We made additional investments with our MRI software update. What that means is better image quality, and if you have to have an MRI, you really want a clear, crisp image. And decreased testing time. So anybody who's ever had an MRI, it feels like an eternity when you are laying on that table trying to not move, hearing the clicking. So with this software update, the testing times have been decreased. We have kicked off the upgrade of our nurse call system. As was referenced earlier, we moved into this facility in 2001, and believe it or not, we brought some of the nurse call system from the old hospital here, so it's beyond time. That has already started and will be going on over the next 6 to 9 months. We've expanded our retail pharmacy access. hugely successful customer service focused area, and we've now added Saturday hours for community members who can't get here Monday through Friday. We also have a locker system, similar to what you would use at Lowe's or Home Depot, where you can call in your refills and pick it up at your convenience, any time or day of the week. We started a pilot program for ambulance transfers. You're probably aware, if you've watched the news at all in the last several years, that transporting patients to higher levels of care is difficult. We recognized that and have started a pilot program where we have an ambulance and staff who are able to take patients when some of our local EMS services are unable to. They've been great partners for us, but they have struggled with staffing as well, and this is a way that we can help support getting patients to the right care location. And then modernization of the facility. We had a huge investment last year in all new lighting, signage, and a brand new employee parking lot. So if you've had to come here in the last 6 months, you've probably found that it's easier to find a parking spot because our employees have moved to a different parking lot. All of this cannot happen without our workforce. It goes without saying, yes, we have a beautiful facility. We have state-of-the-art equipment. But none of that matters without the people within these walls who truly care about what they do. The people are what make a difference, and we care about our people as much as we care for you, our patients. We've continued to take an aggressive stance on compensation and benefits with the support of the board. In order to get the best, we have to pay the best. We offer the best package to each and every employee, and we value the work they do each and every day. Post-COVID, we've made great efforts on recruitment and retention, as you saw with the decrease in our agency staffing. 40% reduction is huge. Agency staff typically costs 3 and 4 times what it would cost a regular staff person in that same position. We have continued to focus on the work environment. I often talk to staff about it being a 3-legged stool. We need market-leading pay, benefits, and the best work environment. The focus on our employees has allowed us to increase retention and decrease turnover by 30% in 2024, which is huge. All of that, I believe, is possible because we have worked really hard to hire the best and celebrate and recognize our employees at various events throughout the year. If you follow us on social media, you will see that we like any excuse to recognize somebody or celebrate something. And our Fun Squad, which is staff and leadership driven, helps us. They come up with all of that work and focus on making sure that the work environment is really a fun place. One of our major recognition events happened in May at the Mount Washington, and it's our annual service recognition event, where we celebrated over 60 employees who represented 720 years of service. The retention, the longevity of our employees is outstanding. We have many, many employees that have been LRH employees for greater than 10, 15, 20. In 2024, we actually recognized an employee who had 45 years of service. And 2 or 3, I think, that had 40 years. So we are very proud of our staff. Continuing to focus on our people, we've had to get creative with the lack of training programs. We've developed our own. So we have Grow Your Own programs where we offer people in the community or within our organization for career opportunity and growth. We have a Grow Your Own medical assistant program, a surgical technician, and central sterile technician. It's all an investment in our people. It's a way to give people an opportunity to move within the organization and to expand their career. We have held all through COVID, when many organizations would not allow nursing students into their units, we did. We continue to focus on the fact that they have to have clinical experiences to finish nursing school, otherwise we aren't going to have nurses to be able to take care of patients. Currently, we have nursing students 7 days a week from nursing programs throughout the state, not just locally. Why students come here, why they've reached out to us is partnerships with some of our nursing leadership. Kim Force has done a tremendous job at partnering with nursing programs throughout the state and working to ensure that students have a clinically rich learning environment. In 2024, we had 182 nursing students who rotated through our units. We have a robust new grad nursing program that has hired a cohort every year since 2020. It continues to grow. It includes a rigorous and extensive 13-week orientation and basically a full year of transition into practice where they have orientation, mentorship, skills, again, focusing on that education and competency to make sure that you have the best person providing care to you. And this past year, out of our new grad cohort, we had 9, and over half of them were existing LRH employees who were in other roles that went to school to become a nurse and are now here on our nursing units. In multiple board meetings, medical staff leadership meetings in the last few months, we've heard from our hospitalists and other surgeons, other physicians in our emergency department, how great this cohort is in their clinical care. Everything I've shared this evening is what makes LRH the premier healthcare organization in the North Country. Our commitment to quality, our community, and our people are the pillars that make us the largest and best employer and healthcare organization. Thank you for your time tonight, and now I would like to invite Claire May and George Mitchell as co-presidents of the LRH Auxiliary.
Hello, everyone, and thank you for an opportunity to share some about the LRH Auxiliary. As we look back at 2024, we are incredibly grateful for our dedicated members who have continued to support Littleton Regional Healthcare through fundraising, educational events, and service projects, from decorating the hospital for the holidays and ensuring a Santa visit on Christmas Eve to presenting gifts for Doctors' Day and Nurses' Day and hosting the Employee Ice Cream Sundae. We remain committed to serving LRH and the community.
And now some highlights from 2024. We awarded $19,000 in scholarships to local graduating seniors and current staff pursuing degrees in medical programs.
We raised over $6,000 through our December basket raffle, thanks to the generous donors, volunteers, and ticket purchasers.
We sold out of cookies within minutes at our December cookie sale, thanks to the incredible demand and support from the LRH staff.
We continued funding for the Reach Out and Read program, providing books to every child born at LRH and every child attending key pediatric milestone appointments at North Country Primary Care.
We supplied clothing for patients in need of replacement clothing, ensuring comfort and dignity during their hospital stay.
Hosted auxiliary member events to bring our community together and encourage engagement in our mission.
Now, looking ahead, we are focused on growing our membership to ensure that we can continue this important work. The Moose-led gift shop, 100% staffed and managed by LRH volunteers, remains our primary fundraiser, and we are always looking for more volunteers to help support its success.
Thank you to our members, volunteers, donors, and supporters for your dedication to LRH Auxiliary. Whether you contribute by volunteering, participating in fundraisers, shopping at the Moose Ledge gift shop, or making donations, your support makes a meaningful impact.
And if you're interested in anything you just heard, you're welcome to join us. All you need is a passion for supporting LRH here, and see us for more information afterwards. Thank you.
Thank you. Thank you all for coming and listening to everyone tonight. It's been great to see so many people here from the community and the hospital itself. It's been a real pleasure to listen to everybody. I've learned a lot, and I'm sure you all have too. And I'm not going to keep you any longer because my favorite part of the night is happening. And Jurgen and the food and nutrition staff have worked incredibly hard to create a feast for you over in conference rooms 1 and 2. So without further ado, please go. Enjoy.